Malaria is a very serious disease that affects millions of people around the world every year, particularly in tropical and subtropical regions. It is not something to be taken lightly. This illness is caused by a tiny parasite, a living thing so small you cannot see it without a powerful microscope. This parasite is a dangerous visitor to the human body, capable of causing severe sickness, and, if left untreated, it can be fatal. Understanding what malaria is and how it spreads is the very first step in protecting ourselves and our families from its harmful effects. It's a global health challenge that requires our full attention. The main carriers of this disease are certain types of mosquitoes. Specifically, it is the female Anopheles mosquito that transmits the parasite from one person to another. When an infected mosquito bites a person to feed on their blood, it injects the malaria parasites directly into the person's bloodstream. It's a silent, quick event that most people barely notice, yet it sets off a dangerous chain reaction inside the body. This is why mosquito control is such a critical part of the fight against malaria. The mosquito is not the cause of the illness itself, but it is the essential vehicle that carries the real culprit. Once inside the human body, the malaria parasite does not immediately cause sickness. Instead, it embarks on a journey, traveling through the bloodstream to a very important organ, the liver. In the liver, the parasites find a safe place to hide and multiply. They grow in number, maturing and preparing for the next stage of their attack. This incubation period can last for several days or even weeks, during which time the infected person may feel perfectly healthy, completely unaware of the growing invasion within them. This hidden phase makes malaria particularly deceptive and difficult to track in its earliest stages. From the liver, the now matured parasites burst out and re-enter the bloodstream in massive numbers. Their new target is the red blood cells, which are the vital cells responsible for carrying oxygen all around our bodies. The parasites invade these red blood cells, continuing to multiply inside them. Eventually, the infected red blood cells rupture, releasing even more parasites to attack other healthy red blood cells. It is this destructive cycle of invasion and rupture that finally triggers the severe symptoms associated with malaria, causing immense damage to the body and making the person feel extremely unwell. The symptoms of malaria often begin like many other common illnesses, which can make it hard to identify at first. A person might start to feel a general sense of not being well, a bit like they are coming down with the flu. This initial stage can include headaches, muscle aches, and a feeling of tiredness that doesn't go away with rest. Because these signs are so general, people might dismiss them as a simple cold or fatigue. However, with malaria, these symptoms are just the beginning of a much more serious condition. It is crucial to pay close attention to how your body feels, especially if you live in or have recently visited an area where malaria is common. As the parasites continue their destructive cycle within the red blood cells, the symptoms become much more specific and severe. The most classic sign of malaria is a pattern of fever, chills, and sweating. This often happens in cycles. A person will suddenly feel intensely cold and start to shiver uncontrollably, even if they are covered in blankets. This is soon followed by a high fever, where the body temperature can rise to dangerous levels. After a few hours of fever, the person will then start to sweat profusely, and their temperature will drop back down, leaving them exhausted but feeling temporarily better before the cycle begins again. Beyond the classic cycle of fever and chills, malaria can cause a range of other distressing symptoms that affect the entire body. The destruction of red blood cells can lead to anemia, a condition where the body doesn't have enough healthy red blood cells, causing weakness, shortness of breath, and pale skin. Many people also experience severe nausea, vomiting, and diarrhea, which can lead to dehydration. The continuous muscle aches and intense headaches can be debilitating, making it nearly impossible for the person to carry on with their daily activities. These symptoms are a clear signal that the body is in a serious fight. If malaria is not treated quickly, it can progress to a much more severe and life-threatening form. This is often called complicated malaria. In this stage, the disease can affect major organs like the brain, kidneys, and lungs. When malaria affects the brain, it is called cerebral malaria, which can cause confusion, seizures, and loss of consciousness. It can also cause kidney failure, severe anemia, and respiratory distress. These complications are medical emergencies that require immediate hospital care. Recognizing the early symptoms is therefore absolutely vital to prevent the disease from reaching this dangerous and often fatal stage. Preventing malaria is far better than having to treat it, and thankfully, there are many simple and effective measures we can all take to protect ourselves. One of the most important tools in our prevention kit is the use of insecticide-treated mosquito nets. Sleeping under one of these nets every single night creates a protective barrier between you and the mosquitoes, which are most active from dusk until dawn. The insecticide on the net not only repels the mosquitoes, but can also kill them on contact, reducing the overall mosquito population in your home and community. Making sure your net has no holes and is tucked in properly around your mattress is key to its effectiveness. Another practical step is to reduce your exposure to mosquito bites, especially during the evening and early morning hours when malaria-carrying mosquitoes are most active. This can be as simple as wearing the right kind of clothing. Opt for long-sleeved shirts and long trousers whenever possible. Light-colored clothing is also a good choice, as mosquitoes seem to be more attracted to dark colors. While it might seem like a very small action, covering your skin significantly reduces the surface area available for mosquitoes to bite, lowering your risk of infection with every inch you cover. Using insect repellent on any exposed skin is another powerful layer of protection. Look for repellents that contain active ingredients like DEET, picaridin, or oil of lemon eucalyptus, as these have been proven to be effective at keeping mosquitoes away. You should apply the repellent carefully to all uncovered parts of your body, such as your hands, face, and ankles. Remember to reapply it as directed on the product label, especially if you are sweating or have been in the water. For young children, it is important to use a repellent that is safe for their age and to apply it for them to avoid contact with their eyes and mouth. Finally, we can take action to control the mosquito population right where we live. Mosquitoes need standing water to lay their eggs and multiply, so eliminating their breeding grounds is a crucial community-wide effort. You should regularly check around your home and empty any containers that hold stagnant water, such as buckets, old tires, flower pots, and blocked gutters. Even a small amount of water can become a breeding site for hundreds of mosquitoes. By keeping our surroundings clean and dry, we make it much harder for mosquitoes to thrive, which helps protect everyone in the neighborhood from malaria and other mosquito-borne diseases. If you suspect you have malaria, it is absolutely essential to seek medical help immediately. Do not wait for the symptoms to become worse. A healthcare professional can perform a simple and quick blood test to confirm if you have the malaria parasite in your blood. Early diagnosis is the key to successful treatment and a full recovery. The sooner you know for sure that it is malaria, the sooner you can begin taking the correct medication. Delaying a diagnosis allows the parasites more time to multiply and cause severe damage to your body, increasing the risk of dangerous complications that are much harder to treat. The primary treatment for malaria is a course of prescription drugs called antimalarials. The specific type of drug your doctor prescribes will depend on several factors, including the type of malaria parasite you are infected with, the severity of your symptoms, and your age. The most common and effective treatments today are artemisinin-based combination therapies, or ACTs. These medications are very good at clearing the parasites from the blood quickly and effectively. It is incredibly important that you take the full course of medication exactly as prescribed by your doctor, even if you start to feel better after a few days. Stopping your treatment early is a very dangerous mistake. Even if your fever is gone and you feel your energy returning, some parasites may still be present in your body. If you do not complete the full course of medication, these remaining parasites can multiply again, and your illness could return, sometimes in a more severe form. Furthermore, incomplete treatment contributes to a much larger problem: drug resistance. When parasites are exposed to low levels of medication, they can develop resistance, making the drugs less effective for everyone in the future. Always finish your medicine to ensure you are fully cured and to protect our life-saving drugs. Staying informed is a vital part of our collective fight against malaria. Knowledge is power, and understanding this disease is crucial for prevention and proper care. For reliable, clear, and up-to-date information, I strongly encourage you to connect with health advocacy platforms. A fantastic resource is AFRIP 365, which shares valuable health tips and news. You can find them and learn more by following AFRIP 365 on their social media channels, including TikTok, Instagram, Facebook, and YouTube. By staying connected, you help build a community that is educated, prepared, and united in the effort to eliminate malaria for good.